IVM.
Hi, this is Almas Virani. I am a speaker, author, coach, change maker, and I have a campaign called #TurnOffTheStereo, where I create awareness on breaking gender stereotypes. I also have a petition on change.org, where I'm asking a leading diaper company to ensure that they include the father's picture on the diaper wrappers. I think it's high time we have fathers be part of inclusive parenting. If you believe in my cause, please go to www.change.org/papapampers2. Hello and welcome back to Beyond Cliché. This is Almas Virani, your host and host that's talking about breaking gender stereotypes on this show today. Benton and Barbie, guns and dolls, pink and blue. We've been conditioned with way too many stereotypes for generations and centuries. I've been thinking about something this morning and I thought I'll talk to you about why do we have 50% of the population in this world not contributing equally to the economy? I mean, more than 50%, actually 51% of the population is women, and we're not really out there adding dollars, rupees, pounds to the economy. So what we do is we really train our girls to be these good mothers, daughters, and wives, but we really don't ask them to discover what they really want to do in life. We give them education, but we don't really allow them to go out and work, right? So they might work, but there's a certain point in their life where they're bearing kids or they're getting married and they decide not to continue work. वैसे, I've not been keeping too well, and I have this family doctor that I go to very regularly, and doctors really intrigue me. Especially women doctors. Now, I'm not really bringing in a stereotype here, but what I've realized is that a family doctor is usually a male doctor, and you must have noticed that. But you will not see too many women family doctors as such. And I've had this family doctor that I go to very regularly, and she's a homeopath. So I actually am a firm believer in homeopathy, and joining me in the studio is my family doctor, a homeopathy doctor and a woman. And I'm very excited to talk to her today about the stereotyping with women doctors. Today's show is about careers and gender stereotyping. Why do we have so many family doctors that are men? Why don't we have too many women in this space? What happens to women doctors that come back to work after their career breaks? Do they really take career breaks? I have a lot of questions in my mind and a lot of questions around homeopathy and women and gender stereotyping. So today on the show with me, I have Dr. Sadaf Ulde, a very close friend and a great doctor. She's really a magician when she's at her work. But I know the kind of stereotyping that she's experiencing in life too with her profession. So, hello, doctor. How are you?
Hi, Almas. I'm good. How about you?
I'm doing fantastic.
Great.
So, I know that we've had a lot of conversations around the way genders are stereotyped in your profession.
Absolutely.
Right? In fact, हम उसी दिन बात कर रहे थे that you have a lot of prospective grooms that come to see you, and the first question they ask you is, क्या आप शादी के बाद काम करेंगी?
Yeah, and it is very you don't understand what these people are up to. They want a doctor wife, in fact, when they hear the word doctor, they come running to you, but their expectation is that you should not practice.
So what are they looking for? The degree, is it?
Yeah, they're looking for a trophy wife.
A trophy wife, I like that. Okay.
Yeah, having a doctor wife at home, and then obviously she's a doctor, so she'll take care of your parents.
तो फ्री में दवाई मिल जाएगी उसको ही नहीं पूरे खानदान को मिल जाएगी
फ्री में शादियों में तुम जाओ तो फ्री में एडवाइस मिल जाएगा
हाँ और शादी के कार्ड पे डॉक्टर भी लग जाएगा so it is that, is it?
Yeah.
Okay, so today for the listeners, I would like to have a deeper conversation with you, Dr. Sadaf Ulde, right? We want to talk about why don't we have a lot of women in this profession and what is happening to the stereotypes. How are stereotypes played out? So let's talk about your journey, and I think that would be a great place to start.
Yeah.
So why did you choose homeopathy being a woman? Do you see a lot of women in this space?
Okay, so very good question. First of all, medicine profession came to me as 3 Idiots देखा है ना? So
Right.
family में हर लड़की डॉक्टर और लड़का इंजीनियर. So,
that is the stereotype in fact, right. But ये लड़कियां जाती कहाँ हैं डॉक्टर बनने के बाद, ये सवाल है.
सेकंड क्वेश्चन है, I'll come to that. तो हमारा ऐसा हुआ, I always wanted to be a model. I always wanted to be an actress. But I come from a very cultural background. So my parents was like, no, nothing doing. And on top of that, my mom, who is a great icon for me, she told me, Dekh beta, if you take up acting, if you take up journalism, if you take up anything, शादी के बाद ना, they will impose you to sit at home. But medical is a profession, you can even sit at home and practice.
तो convenience option है.
So it's a very convenient option. So you should take that. तो मेरा मन तो इतना नहीं था, but मम्मी का मन रखने के लिए मैंने medical ले लिया. And yeah, and my sister wanted to be a dentist and she wanted to be an MBBS doctor by birth, like वो born doctor है. But I'm not a born doctor. It's like for me, medical profession is an arranged marriage.
Yeah, you always talk about it. She said that homeopathy is an arranged marriage
for me. But obviously, this is a kind of arranged marriage where I fell in love with. When I saw patients, when I understood the whole philosophy of homeopathy, I actually fell in love with it because it resonates to my soul. You know, it resonates to something that I corely believe. I'm a very philosophical person, and homeopathy has a strong philosophical base, and I enjoyed it. And I enjoyed it to a अलग ही level. So I really like doing it. So इस तरह से I came into the medical profession, like I said. But like your second question was that, you know, if you have why not so many homeopathic doctors? तो मेरा कॉलेज में ना बहुत इंटरेस्टिंग सवाल होता था मेरे फ्रेंड्स के साथ कि तुमको आगे क्या बनना है. So there are certain icons in homeopathy. Dr. Rajan Shankaran, Dr. Vijayakar, Dr. Samuel Hahnemann, Dr. George Vitholkar. आपने देखा इसमें से एक भी फीमेल नाम आया?
Correct.
Right? Now, out of these 4, there were 2 female homeopaths who really inspired me. Dr. Parinaz Umranwala, Dr. Divya Chhabra. I said, इतने सारे homeopaths every year pass out होते हैं, and there is only one damn Parinaz Umranwala and one damn Divya Chhabra.
Right.
Rest all males.
Right.
You go to, so in medicines, we have a regular seminars where we go, we teach, and I wouldn't see a female homeopath standing on the stage. And as a student, whenever I will sit in the audience, I will tell myself, one day I will be on that stage.
I'm sure you would be, with the passion that you have for the profession.
I am actually now. I had recently some seminars in Kerala. I was teaching a crowd of 1,000 homeopaths. But still, yet the struggle is real even now for me. But yeah, that time in my college, I'll sit in the audience and say, one day I'll be there on the stage addressing an international conference, just like Dr. Rajan Shankaran, or just like Dr. Praful Vijayakar.
Right.
And it will be first female homeopaths. Then I went and I started talking to my colleagues.
Right.
So one junior of mine gave a very interesting answer. I said, why did you choose homeopathy?
Yeah, that was going to be my question, but we've spoken about it now.
Yeah. So I asked my friend, why did you choose homeopathy? And her answer really, astonished me. She's like, see, I couldn't afford MBBS. Okay. But I wanted to be a doctor because doctor gives you a good perspective grooms. I was like, seriously? That's your aim in life, to get married?
Right. So a lot of women are choosing this as a convenient profession. अच्छा लड़का मिल जाएगा, शादी हो जाएगी, degree भी हो जाएगी. So we're going to take a little pause here and we're going to talk about your journey in medical school. So you said that in the classroom you saw this disparity. So let's just talk a little bit about that, right? So what was the ratio like? Let's start from there.
So yes, interestingly, in medical schools, you will see a lot of female candidates are coming. So in my class of 101, I think we only had 30 or 40 boys.
Oh.
So good for boys. They had many options. Bad for girls. We had no option.
Right. So how many students are we talking about?
So I'm telling about, my class was 101 and say around 60-70 were girls.
Lovely. And then what happens when they get back to work?
Wow.
So college has got this disparity. So लड़के कम है, लड़कियां ज़्यादा हैं.
Exactly. In fact, हमारा जो जूनियर बैच था ना, उसमें तो ये हाल हो गया था कि उनकी क्रिकेट टीम भी नहीं बन रही थी, इतने कम लड़के थे.
ओहो. Interesting.
So the thing is, parents feel कि भाई डॉक्टर की डिग्री ही चाहिए, अच्छा लड़का मिल जाएगा, तो डाल दो BHMS में. And in this bargain, who suffers is not the woman, what I see, it's not the female class or the male class or anyone, it is the patients who suffer. They are deprived of a treatment which is so natural and which can bring about so much of cure. So yeah, it's very saddening. जैसे हमारे 70 के बैच में से आधे तो शिफ्ट हो गए अब्रॉड शिफ्ट हो गए हैं. तो in medical it's not easy. You have to give your license, वापस से कोर्स रिपीट करना पड़ता है, ये करना पड़ता है. So it's a very so husband will say, यार मैं तो लाखों डॉलर्स कमा रहा हूँ, तो तू क्यों इतना एग्जाम वगैरह देने में पैसा खर्चा कर रही है?
Right. So you're saying there's a struggle. If the groom wants to move abroad, let's say he's a software engineer with a green card in the US, and he is getting married to this girl who's a doctor, degree hai bhaiya uske paas. So moving abroad for a doctor is a big challenge. Can you tell me what is that?
So number one is we have to give a lot of license exams. There are certain countries, they don't accept Indian degrees. So you have to redo your studies. Like my sister is a dentist. When she moved to US, she had to redo her studies. But luckily she has a good husband. So to avoid her this pain, they moved to Canada. So now it's like, my nephew is 3 years old. Bichari abhi tak license hi de rahi hai. So it's like that. It's a huge gap that comes in between till we get going with the profession. And medical profession एक ऐसा profession है कि ऐसा नहीं है कि तुमने 4 साल का डिग्री कर लिया और चुपचाप घर में कोई जॉब ज्वाइन कर लिया and you're minting money.
Right.
It's an ongoing investment. You keep studying and every course is like 1 lakh, 2 lakhs, 3 lakhs, 4 lakhs. You have to just pour money to get educated, to get your expertise. And then comes the setup. Places like Mumbai where the rent and all is shooting up, to own a clinic is not easy. Agar 1 lakh rupe ka rent hai, so what do I charge my patient?
Right.
So it's a challenge. So husbands very conveniently say, yaar इसमें तो मेरा पैसा भी जाएगा, till you settle down. तो उससे अच्छा तू घर में बैठ जा.
Interesting. I think that's an interesting note for us to take a break. So we're talking about doctors and the gender stereotyping around this profession. So we have a lot of male doctors as compared to female doctors. Why is that happening? So we've just had an interesting context setting that we've done with Dr. Sadaf Ulde. We've spoken about more women filling up seats in the classroom, but not the seats in the OPD sections of hospitals. So at this point, we're going to take a break. Once we come back, we're going to talk about why is this really happening. Thank you for joining me for this moment. This is Almas on Beyond Cliché.
Hey everybody, welcome to another amazing week on the IVM Podcast Network. If you aren't following us on social media, why aren't you? We're IVM Podcast on Twitter, Facebook, and Instagram. Like to thank our sponsors this week, Paytm Money and HDFC Life. We appreciate our sponsors, and hey, this doesn't happen without them. On Paisa Vaisa, Anupam is in conversation with PV Subramaniam, author and CEO of Subramani.com, to talk about how important it is to plan for your retirement. On Geek Fruit, Tejas Dinkar and Jishnu discuss the teaser and Batsuit reveal for the new Batman movie starring Robert Pattinson. This week on IVM Likes, Abbas, Ritika and Antariksh talk about movies with multiple plot lines that come together in the end. On Litnama, Lakshmi talks to Hardik Waghela and Mohammad Muneem from the band The Words of Alif. They talk about how the band came to be and more. On Football the guys talk about Liverpool qualifying for the Champions League, City getting banned from it, and Arsenal thrashing Newcastle for a 4-0 win. On Postcards from Nowhere, Utsav shares some dark truths about Indian food. On the Filter Coffee podcast, Karthik is joined by CEO and founder of the My Child app, Harsh Sangra, to discuss this journey of a startup. On Ganatantra, host Surya and Alok speak with Professor Chandan Gowda about Karnataka politics and history. On Beyond Cliché, Almas is joined by the Mahi Way actor Pushti Shakti to talk about beauty beyond size. On the Pragati podcast, Pawan is joined by Avinish Ambale, who sheds light on what is artificial intelligence and how do we learn what we learn. On Simplified, Chuck, Naren and Tony talk about stoicism. And with that, let's get you back to your show.
Welcome back to Beyond Cliché. This is your host Indostal, and today we're talking about gender stereotyping in the medical profession. And joining me in the studio is the very beautiful Dr. Sadaf Ulde, who's had an arranged marriage with homeopathy, and she ultimately fell in love with that, and I'm in love with her medicines. So before we took this break, we spoke about this whole space of why there are more women filling the seats in the medical school, but not the OPD section in hospitals. So we're going to talk a little bit about your journey, the struggle that you've had getting into the profession from college, and what's happening. What's the gender stereotyping space there? So let's talk about your journey. From college, now you're in the workspace.
Yeah.
Kya hua? What happened?
So what happens is when you pass out, okay, and in medical profession, it's very typical that you go and assist someone, some known doctor, or you are with some senior doctor who will teach you. So hota ye hai ki when it comes for meeting such people, they want a lot of female doctors, but they give you very menial work because they know they are going to be there till they get married, and then they may practice or they may not practice.
Right.
So they always question how much are you going to be with them. Okay. Second thing that comes up is so interesting when you work, if you ask for a job or if you ask for a money, so when it's एक बहुत typical situation हुआ था where I started working in a place, and so there were some of my colleagues who will say, अरे तुझे क्या करना है यार, इतना पैसा, तू तो लड़की है, तू क्या कर लेगी इतना कमा के.
So what do you say at that point in time?
I was like, hello, लड़की हो तो क्या हुआ भाई, मुझे भी तो पैसे की जरूरत है. नहीं, but you have your parents to take care. You are not the what do you say, sole earner of the family, or you're not the breadwinner of the family. Why do you need so much money?
Right.
Like, why do I need? Isn't my hard work, my talent mean something? Right. Or it's just that just because I'm a female, you can make me work long hours, and then even getting on to projects which will mean traveling, or which will mean, so sometimes there's a restriction from your family, sometimes your workplace is open to it, but your family may not be open to it. Then there's a whole struggle of convincing them that, okay, yes, it's okay for us to also travel. So yeah, at the workplace, then so we have this thing where we had a training program where we teach homeopathic doctors. Right. So in that also we will see so I came up to be in this training program as one of the very good teachers, right? But still the number of lectures assigned to me were very few.
Oh, interesting.
So I don't know what it was, but there was an open conversation in the group. I don't know about the authorities, but in the group, हाँ वैसे भी तो लड़की, तुझे क्या करना है इतने lectures लेके. So the whole idea, the way a person looks at you, अरे तू तो लड़की है, शादी के बाद तू तो होम्योपैथी छोड़ने ही वाली है. That's a basic.
So it's a mindset.
It's a mindset.
So you're facing this sort of biased perception from the society, people within your own profession, whether it comes to projects or giving you the kind of exposure, all of that is differently played out. What is it for the other gender? Let's talk a little bit about that, because we're talking about gender stereotyping here.
So here what happens is, now for other gender also, एक बहुत drawback hota. I will not talk about female drawbacks only, male drawbacks I'll talk about.
Yes, absolutely.
So male drawback ये होता है ना कि when they want, any senior doctor wants an assistant, they will not want a male doctor. Because male doctors will come up with their voice very strongly. कि ये गलत है तो गलत है, या ये सही है तो सही है. And then once this male doctor who's junior learns from a senior doctor and develops his own kind of value system or his own identity, right, his own set of values, फिर ये senior doctor का और ये doctor का clash हो जाता है. तो जब भी कोई मेल डॉक्टर कहीं पे असिस्टेंट के लिए जाता है, अरे नहीं यार लड़के नहीं चाहिए, लड़कियां होंगी तो बोलो. और बड़ा आसान होता है ये बोलने को कि भाई देयर आर गर्ल्स, दे विल लिसन टू व्हाट whatever we say or whatever work we dump on them, but males will not do it. But which may or may not be a case.
So does that give less opportunity to men when they're starting their medical profession?
Yeah, like then they are forced to go into places where they are doing RMOship or they are doing something else. Yeah, it's a difficult situation. And for them, it's not just females who leave homeopathy. There are some male doctors also who leave homeopathy after a certain point.
What's the reason?
The reason being, the first thing, the mindset, you are a man and you need to bring something on the plate, hook or by crook. So then I know some of my friends in my college who would have been an excellent homeopathic doctors, but they left homeopathy because they wanted to earn more, earn quick, because they wanted to settle down, because they wanted to have their own families. So yeah, that was a...
So we've had a lot of conversation on this offline as well, and homeopathy, because it's not considered as mainstream medicine, the kind of fees that doctors charge is predominantly less as compared to regular medicine. And this could be one of the reasons why you have more women filling seats in college, because ultimately it's not going to pay you that much. तो लड़के को homeopathic doctor क्यों बनाना है? पैसा डालना ही है तो उसको mainstream profession में डाल दो. That is a mindset that we have. Do you have any numbers that you can share with us in terms of how many women doctors versus men doctors do you have in India?
So I will not have an exact ratio right now with me, but you can say every year, out of the chunk that passes out, it is 70% who are females. Okay, and every year this number is increasing. Like recently, I had been to one of the colleges in Ahmednagar to give a lecture, and there in the classroom of say 100 to 100, there were hardly 30-40 boys. So yeah.
And then how many of them actually drop out after they get married?
Most of them. Most of the female homeopaths
They just
drop
stop
out.
their profession, their practice? What do?
They either stop their practice, or if they're moving abroad, they, according to what will suit their husband, they join some part-time other jobs. Like nowadays there are a lot of streams that are open up, like medical writing, medical transcription, clinical research. So they kind of deviate to that because it's quick money. At least they are working and their husbands are not questioning. But they do not follow homeopathy because money is a big factor. And by default, 9 months, there's a break. 9 months, 2 years till the baby is growing. There's a break in almost all the female homeopaths.
So let's talk a little bit about how it impacts a doctor emotionally, psychologically. You've studied, you've been practicing, you're making a difference out there, you're healing people. And now you have to change your profession to something which is probably paying you a little bit more, and you're doing it from home, managing your kids.
Well, if I have to do that, Almas, I'll tell you it will be killing me. If I have to do anything which is besides homeopathy, and it's anything there... See, one thing is, you don't have that much of kida for certain things, you know.
Right.
You don't have a passion for something.
Right.
But somebody who will have a passion like me for homeopathy, if I have to do something else besides that, it will be as good as suffocating me, imprisoning me. You know, I cannot take that. You know, even the thought of it will give me tears. So yeah, it's a very difficult thing. And we have, so I work in an academy as a faculty. So there we have this course as refreshers course. So female homeopaths who have taken a lot of break, they come back and I talk to them and I see the despair in their eyes. You know, that, oh my God, we have lost so many years. I have homeopath like 40, 45 years, like they might be 10, 20 years elder to me. They have passed out when I have not even entered the college. They come and look, they come up and look up to me like, oh my God, you're so junior to us and you know better homeopathy than us. And then creeps in that sense of failure. What were we doing all these years? There's such an emotional trauma. You know, you have invested. So unlike other profession, when you are, whichever field of medicine you are, whether it's allopathy, homeopathy, Ayurveda, I don't know as a teenager if I have gone to a disco. In fact, till date I have not gone because there's no time for that. We have not gone for any parties. The 10 standard, 11 standard, 12 standard, which is a prime teenage years, our heads will be in the books.
Correct.
You know, our life was all dedicated to the books.
Now it's dedicated to your patients. I see that all the time. Right?
And after the books, you are gone into medical college. There you are completely swept up. Every month there's a periodical. Every month there's a university exam. There's a sword hanging over your, so where you don't have time to enjoy much.
Correct.
Okay, then you come out in the field, you are doing your hospital rotations, your bladders are full, still you have to attend your patients, you might yourself be in pain, you might be into a lot of things, but you have to be there in the OPD standing. I remember when I newly passed out, I will leave my house at morning 4 o'clock and be back not before 11, 12 at night. So it used to be that painful and not paid single penny for this. Sometimes even midnight. And no senior doctor is paying you because you get to learn from them.
Right. And then you've not practiced for years. So obviously it is going to have a psychological impact on you. It's a reflective and emotional moment here in the studio with Dr. Sadaf Ulde, where we're talking about how women that are filling the seats in the colleges then get to work, somehow working tirelessly with full bladders, like she said, attending to patients just out of the passion. And now they're on a break because they have family to attend to. We're going to take a break here. When we come back, we're talking about the women that actually stay in the profession. Do they face any kind of bias? And also we'll talk about men and what's really happening with the pressures that they go through. Yeah.
How does one separate news from opinion? I'm Mahrukh Inayat, a news junkie, but not a big fan of debates. I love facts, and I like to stick to them. No frills, just pure analysis. This election season, is Balakot a game changer for 2019? Did Priyanka Gandhi Vadra join politics too late? The Chowkidar Wars. Who's really winning? I will cut the clutter and analyze the stories that matter to you.
You can listen to the show on the IVM Podcasts app or wherever you get your podcasts.
Welcome back to Beyond Cliché. With me, your host and dostal. And with me in the studio is Dr. Sadaf Ulde, a homeopathic practitioner, holistic healer and psychotherapist. And we've been talking about the gender stereotyping in the medical profession, and we've been talking specifically about homeopathy. So far, we've explored that we have more women doctors in colleges trying to get their degrees because unko acha ladka mil jayega shaadi karne ke liye. And we've spoken about the kind of pressure that the men go through with not being able to find enough opportunities to assist because there are more girls out there. And then we've spoken about the breaks that women end up taking after a certain transition in their life. And women have multiple transitions. Dr. Sadaf Ulde, at this point, we would like to talk about what's happening with the stereotype roles that men have in the medical profession. So you work with a lot of doctors that are men. What are the kind of pressures that they're going through as a result of this stereotyping?
Oof, I can't even imagine their pressure. We talk about a lot of things that females are deprived of, but I feel the men doctors, if they want to, I know one of my friend who really wanted to pursue homeopathy. The poor thing is to work with us for like 6 hours, 8 hours. Then he will go night duties in hospitals, which will get money.
Right, right.
So there's so much of pressure that if he wants to create some of his own dream, of his own idea, he cannot do that. Because it will mean not providing the family, and on top of that, if this person is married,
right,
so they do a lot of sacrifice, I believe, sacrifice in the front of their careers. Maybe they will want to learn more,
correct.
Maybe they want to do something very innovative, but innovation, studies, everything comes with a cost, and they cannot do that because the whole burden of running the family is on that poor man.
Right.
So he just gives up on his dreams, and just like routinely he will go to his clinic, do stuff out, or maybe change the profession, like I said. So many guys I know who are so good who could have turned out to be such a good homeopathic doctors have lost it. They have done like GP practice, or they will join some hospitals, or they will do hospital administration, or they will do clinical research. Not that it's bad. If they like it, it's different. I'm not talking about the guys who like hospital administration, or guys who like clinical research, or guys who like GP practice. But there are guys out there who would love to do homeopathy, but they cannot even think of it. Like I know one of my friend, I said, Bhaiya, when are you starting your own clinic? So he's like, that's very difficult question. I can't do it.
So the primary reason for that is homeopathy is a less paid profession as compared to
So what
mainstream
happens
medicine.
is when you pass out as an MBBS doctor, you for your internship you get a 50,000 salary. Okay, but for a homeopath you're not even paid 2,000 rupees. I remember when I was in my internship, the first salary that I got was 1,500 rupees. What is 1,500 rupees?
Right.
Nothing on this, and in fact, then that also I was doing an RMOship with the allopathic hospital. When I decided I want to do homeopathy, I was not paid for almost 2-3 years. And then I got an opportunity to work with Dr. Rajan Shankaran, and he started with, that was the first salary that I received in hand, which was also like 15,000. And, this, you can see the most menial thing is even a receptionist, even a driver is paid more than 15,000, and a homeopath doctor, no. At the same time, the government medical hospital in Vileparla, they asked me for a post for a resident doctor over there. I said, I would love to do that, a full-time resident doctor in a government homeopathic hospital, But you will imagine a 24 hours job, and what was the salary they were offering me? I'm talking about in 2009, 2010, 1,500 rupees.
Yeah, so there's definitely money that is a predominant player in deciding who really gets into this profession, and it's more to do with whether you're able to provide or not. So this is clearly one of those professions where you see a lot of men not really taking this seriously because there's less money there, and there's clearly an imbalance. So usually men are the providers, women are the nurturers, and clearly yahan dikh raha hai that because there's less money, traditionally that role of a provider is something that a man will not be able to fulfill completely, or will have a lot of challenges. So why take this profession? And for a woman, you have to now nurture, you have kids, so might as well take a break. So definitely there is a huge stereotyping there. Now let's talk a little bit about when patients have to decide which doctor do they have to go to. It's like this, right? There are a lot of professions and we see stereotypes there. In fact, I was flying, and the person next to me was during a turbulence made a statement, "Arey, female pilot hai, to pata nahi kya hone wala hai" types. So does that happen with doctors as well?
Oh, obviously. So like I said, I'm into teaching as well as into practice. So जब practice में हम बैठते हैं ना, I'll give you one typical incident when I was practicing. While I was working with an institute, and we had a group made, a male doctor and a female doctor. So हमेशा ऐसा होता था ना कि female doctor देख के ना हमेशा patient तुम पे चढ़ जाता था. He will always be like, he will question you, or he'll try to overpower you. And the moment the male doctor will come and say the same thing, this patient will go silent.
But this patient meaning a woman patient or a male patient?
Both.
Any patient?
Any patient. Sadly, the thing is, for women at least, I don't know about men, but for women at least, the biggest enemy of a woman is a woman, I've seen.
Well, that's a stereotype again. But in my opinion, I feel I've seen a lot of women that are patriarchal.
Yeah.
And a lot of men who are feminists. So really patriarchy is the problem here. Yeah. It's a mindset that if there's a male doctor, then more efficient has more knowledge, etc., etc.
And plus the command that comes through a male doctor. And if female doctor is too commanding, or if you're in a workplace, if you're too commanding, then you become kind of a
तो मसला जो है वो अथॉरिटी का है. दैट मेल डॉक्टर हैज मोर अथॉरिटी.
और अगर औरत ने अगर बहुत अथॉरिटी दिखाने की कोशिश की तो वो या तो पीएमएस सिंह है या तो फिर शी इज सम अदर she cannot be dominating kind of.
Right. Yeah. Would you like to share an experience where a patient really intimidated you in a way, but just because of your gender, was not willing to sort of take...
So in homeopathy, we have this case-taking process, okay, where we ask a lot of details. So there was this small girl...
Yeah, you have long conversations, sometimes even 3-4 hours, right?
So there was this small girl who's had a very severe illness, very, very incurable illness. So I was genuinely taking her history, okay? I was asking her question after question, question after question. So the father of this child really got on me. What the hell is this? And then I was like, okay, what do I do? So then what happened is at the same time, one of my friend entered the cabin by mistake. So he saw me and he's like, okay, what happened? So I told like this. Then he sat on the chair and he started taking the case. He completely obliged to it.
Let's just kind of get a few facts here. How senior was this doctor?
Just 2 or 3 years.
Okay. And in terms of appearance, did he have a lot of grey hair?
No. He didn't have a grey hair, but he had a good stout personality.
So there was a lot of authority and command in the personality. Yeah. Right.
And back then I will, you were new. Right now, nobody can try to be like this with me. But back then, when you're a new pass out and still adjusting with things, it was I was a little timid, you can say. So it was very difficult for this. But still, when I was asking his question, I was explaining him, I went on and I said, no, this is wrong. You have to understand why I'm saying this. He was not ready to accept it from me. But same thing when my friend barged in and he spoke, it was good. Similarly, I will work with a psychiatrist doctor who will practice homeopathy. So I will see the counseling impact that he will make with a man voice was really very different from what will happen with me in the picture, especially with the family. And there's one thing about homeopathy.
But I'm sorry to interrupt you. I rarely do that, but this is an important point. When we talk about professions like counseling, psychiatry, all of that, you also need to connect with the patient.
True.
Right? And homeopathy is known to be a softer medicine, at least in the minds of people. So does it happen that and you're a psychotherapist and a healer, do you have more people that come to you because you're a woman and you're able to connect with people at an emotional level as compared to a man? And I'm not saying men cannot in any way connect. That is not the idea. We're really talking about how stereotypes work in the minds of people.
Well, in that case, I will say not so much. It's not like it has to do more with an individual connect. The problem will occur is homeopathy, self-healing is something which people don't really buy. It's very easy for people to pop in pill.
Correct.
If you're going to a conventional doctor and that doctor is giving you pills, you're taking it for years. In fact, like for example, diabetes. You take for lifetime, your diabetes is not going. They're still okay with it.
Right.
But when it comes to homeopathy, 3 months mein they want magic to happen. So that part of convincing when it comes, I feel that it might be my perception, but I feel when it comes to a male doctor, they easily respect. So if I say some do's and don'ts, I don't know how much they'll respect, but when it comes from a male doctor, patients often take it seriously. Maybe it might be because their tone has that command of authority or what, but yes, it does happen.
I know for a fact that you have a lot of repeat clients.
Yeah.
People keep coming back to you, and I've been your patient for a while. So how difficult is it in the homeopathy profession for a woman doctor to get new clients or new patients as compared to a doctor who's a man?
I don't think it's that difficult, but like I said, the convincing part of getting a patient to take homeopathy. For a female, they may not take you, being a female, they don't take you so seriously. But if it's a man doctor, I feel there is a little bit of authority that comes in and people tend to get convinced faster. That's what I've seen.
Right. This is an interesting show actually, because we talk about stereotyping. Turn Off the Stereo is about stereotyping. And we're talking about 2 stereotypes here. One, homeopathy itself has a stereotype in people's minds, right? Yeah, some of them even call it a placebo. Yeah. And I know you're very touchy about it. I don't. I love homeopathy. And then we're talking about the genders in this space, right? Let's spend the rest of the time with us together in the studio talking about how can we turn off the stereo. Are people doing that? And how? What are the solutions to this situation with gender stereotyping in homeopathy?
Okay, so I feel the trends now have begun to change. Now, how I'll tell you, because I feel the newer generation of female homeopaths have started taking their dreams in their hand. Like, for example, me. Right. I will rather be unmarried than compromise on my career. Right. So I feel there is a shift that is happening. Okay. I feel people have now, because they have seen me struggle throughout and they have seen me consistent with my work, they believe in me now. Initially, whether it were my senior doctors, teachers, I don't know how much they would believe in me. But now when they talk to me with respect. They talk to me with an, they want to give me an opportunity. Things are changing.
Right.
So I feel, in homeopathy we say the cause of the disease is not outside, but it's inside.
Inside,
So
absolutely.
I feel it's universal truth. If you want to turn off anything, we need to change within ourselves. पहले तो हमारे दिमाग से ये निकालना है कि I am a female, so I cannot do it.
Correct.
You have to be very clear. You may be very happy being a housewife. That's fine. But you have to be internally clear that I enjoy this role more than this role. Then I think there's not a problem. Nobody can come between you and your dreams. That's the first thing that I would like to change. Second thing is I feel there needs to be more opportunities out there.
Right.
When there are more opportunities, people are automatically driven towards that.
Right.
So my struggle or my vision is to have these opportunities where a lot of female homeopaths, if they really have this fire in their belly, even if they are pregnant, they can practice. Because we don't deal with harmful chemicals that will come in between their kid or themselves. In fact, this is the most gentle medicine, and more you are healing the patient, you
the
heal
more
yourself.
you're healing yourself, right?
Yeah.
So what do you mean by opportunities? Like, how can we create more opportunities?
So I have a dream, okay, I have a vision that I should create a space where even I remember my mom's dialogue, you're a doctor, so you can even start in your house. So create a system where somebody is ready to practice, they can practice anywhere and they get their patients. They can practice at comfort of their home. They can practice at comfort of whatever they want. But they practice. That's my vision.
Lovely.
So,
lovely.
but they practice. If they want to practice, they practice. And I want to create a system of support where I'm helping them in their difficult cases. I'm helping them get more patients, get more revenue. Yeah, creating
Lovely.
more.
I'm so excited to hear some of this stuff. I can totally imagine work from home or a system where doctors can practice no matter what the transition is in their life. What about men? We want more men that really think homeopathy is their passion, to be a part of this profession, but they're clearly not picking it up because it's not paying them as much as mainstream medicine. What is the solution there?
Again, the same thing for men also, because like I said, the many stalwarts of homeopathy are men. So for them it's still an easy game. It's just that they have to be more determined, and like I said, more opportunities need to be created by government, by people who are doing good in homeopathy, like the stalwarts. They need to create some more opportunities for these people so that they stick into the system of practice, create more better result, create more better research, so that the audience, the lay people also understand homeopathy. और जिस तरह से हर घर में क्रोसिन पैरासिटामोल मिलता है, उस तरह हर घर में एक बेलेडोना और एक आर्निका मिले. So I think,
Wow, what a lovely thought. You also have a petition on change.org for this, right?
Yeah.
What is it about?
So it's about creating, so like I said, homeopathic institutes are not paid well. So even if I'm an MD, okay, and I go in college to teach, I'll be paid 20,000.
What is the other side of the story? How much do mainstream doctors get paid?
Mainstream, if there are professors, they get 20,000 per hour.
That's huge disparity.
Yeah.
So definitely this is not playing out even for the male gender because it's not paying them that much. So what is your petition? If you can just crisply tell the listeners.
So my petition is asking the government to increase the pay scale of homeopaths and to give them an equal opportunities. And if they are having a homeopathic clinic in government hospitals, more of homeopathic clinics, so that even there are two aspects to this, that even the lower strata of society can benefit from homeopathy and more awareness and more jobs.
Right, and more you'll have less women dropping their careers midway and continuing their practice, and more men that are passionate about this line of medicine getting into this mainstream medicine. Lovely. What a conversation, Dr. Sadaf Ulde. I've learned so much about what's happening in the medical profession out there, especially in the space of this beautiful medicine of homeopathy. जैसे आपने कहा, हर घर में क्रोसिन के साथ क्या होना चाहिए? What is that medicine?
Belladonna and Ardent.
Okay, right. So we need to have that medicine. We need to have a lot of women and men going out there and really pursuing their passion for homeopathy without any stereotypes. Thank you so much for joining us in the studio.
Thank you, Almas, for giving me an opportunity to talk to you.
Lovely.
It was lovely.
Thank you so much. And this is me, Al, signing off with every girl and every boy that wants to take their passion to the next level. Like she said, the change is inside, right? We as a society need to allow them to take that plunge and pursue what they want to do. We need more opportunities. We need to change the system. And that is exactly how we're going to turn off the stereo. Thank you so much.
Every week comes a show where three people come together to tell you about stuff they like. A movie, a TV show, a book, and other stuff. Tune in every Monday on the IVM Podcast app to IVM Likes. Batman approves this message. Thank you, Batman.